Hello, everyone. It's Dr. Jensen from Dean's Chat. If you're on the fence as to whether you want to join the American Podiatric Medical Association, jump on in. It's a new APMA. Whether it's advocacy concerns, scope of practice, billing and coding, consider membership at the APMA as your professional insurance. Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the co-host for the Dean's Chat podcast. Once again, I'm with my co-host, Dr. Johanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I'm doing fabulous. You were given a lecture at a meeting this past weekend, I heard.
Yes, yeah, UCSF St. Mary's put on an excellent symposium. They actually had two different fantastic talks about neuromodulation and pain. And oh man, it's just so exciting to get a bunch of people together and kind of nerd out on new technologies. And yeah, it was great. It was really fun.
What was your topic?
My topic was on whether juvenile particulate cartilage is still a viable option for cartilage repair. And fun fact, spoiler alert, the answer is sometimes. As all things in medicine, right? But
it
does not actually repair hyaline cartilage the way I think we had all hoped that it was going to. I think the cat is officially out of the bag, that it does a reasonable job, and there's definitely some pros to it. But that is not one of them, unfortunately.
All right. Sounds good. Well, thank you. That's our little clinical panel for the day.
Yeah, there you go. Fun fact.
Joe, we have a phenomenal guest today. Joining us, Dr. Nicholas Igbinigie. Well, Nicholas, welcome to Dean's Chat. We're so glad that you could take the time to join us today. It's always amazing when Joe and I do these interviews, they last 40 or 45 minutes, and it just seems like it's 10 or 15 minutes.
Well, pleasure having me. Thank you.
You're welcome. Well, if it's okay with you, let's go first names. We'll go with Nicholas, Joe, and Jeff.
I'm good with that. Thank you.
Yeah, Nick, thank you so much. Jeff, this is one of those really fun ones because Nick and I actually connected originally through social media, and I am not really a huge social media person, but my new favorite thing about it is getting to meet people. And what I really love is that Nick was brave enough at APMA this summer to come up and say hello. So not just were we kind of friends and, you follow each other and like each other's stuff on social media, but to actually come up and have that real face-to-face human interaction. And that was just so much fun. And so this has been a very long time coming, Nick, to get you on the show. But I'm really, really excited to have you today. So thank you so much. We'll do a brief intro. So you went to the Texas A&M University, College Station, Texas, with your Bachelor's of Science in Kinesiology, then went on to complete your podiatric medical degree with Barry University. And then currently you're the third-year resident at the Podiatry Residency in HCA Houston Healthcare. Welcome to Dean's Chat. I'd love to start with a little bit about why did you pick Texas? You're obviously from Texas. Was that the driver, or what was it about the area that brought you back home?
I'll be honest. So I am in Houston, Texas. Houston, Texas is actually one of the biggest medical centers in the country. So why not go to the place I can get the most training, in my opinion? And of course, I'm a Texas boy, proud Texan through and through. So yeah, it was a no-brainer for me.
I love that. Well, I was born in Texas, so I'm kind of like a little bit that I'll claim of Texas, but we moved when I was a kid. So it's like the bonding of the Texans. Yeah, I'll claim it. It's as close to anything else that I can claim. So the other thing I would love to get from you, we're coming into the interview season for students. So if you can talk a little bit about what it was like going from that transition of being a student and then transitioning into residency. What are some of the things that you wish you would have known, or maybe pieces of advice, pearls, tips? What would you offer the students that are getting ready to make those transitions here coming up in the next couple months?
Sure. So I think the advice I was actually given was something I always share to every student, is that the programs that you're going to are interviewing you just as much as you're interviewing them. So that's one thing to keep in mind. Also, the other thing that someone told me is like, don't look at what you're doing as a student, but look at how the residents are, and look at each year and see the progression. I think a lot of times as students, we get so caught up on the day-to-day. What am I actually doing personally? But one thing that is phenomenal to see is seeing the first year and seeing the third year. And each year is seeing the progression of knowledge and the progression of skill sets and everything like that. And something I actually valued that advice when I got it. And I think that's actually what made me pick the program that I did go to. So,
I can definitely appreciate that. And Jeff, I'm sure you can mirror this. It is absolutely one of those situations where students want all that hands-on, they want to do all the things, but as you're really in it, you don't also get to have those small reflections of what is the interaction between the attending and the resident like? What is how much is the resident doing? How confident are they? Whereas when you have the opportunity as a student to step back a little bit and just kind of be in the surveillance part of, as you said, do I want to be here? Is this where I want to invest my time? Is this the place that I, as a learner, will get the best out of me and my learning experience in the times where it really matters, where that's where that hands-on training really should be, is at the resident level, not at the student level. So I appreciate your sentiments on that. Jeff, what are your
oh,
thoughts?
one more
Oh,
thing,
go
one
ahead,
more
Nick.
thing.
Yeah,
So
yeah.
sorry. Also, I think as a student, it is very wise of you to always humble yourself to understand that you are at the bottom of the food chain, whether it's the janitor, scrub tech, the resident, the attending, whoever it is. I think it is wise to learn every single part while you're a student, because those humble beginnings is actually what causes you to be a better resident and a better attending in the future. Sorry, just have to add that because that was very instrumental when I was going through as a student through externships. So.
Well, there's benefits to
Oh,
that too, Nick. That
huge pearl. Yeah.
yeah, one of the benefits is that you can ask any question you want at any time, and nobody's going to say you ought to know that by now. I mean,
Right.
but the other thing is, you're right, Joe and Nick. You both brought this up. Watching the residents that are ahead of you is a tremendous benchmark, if you will, because that 1,000-day experience of 3 years of training on a day-to-day level is going to be up and down, and some days better than others. And you can't really look at it each day. You got to look at it in each totality of a year. So, especially in programs with multiple residents, you really get a feel for what you should look like at the end of your first year, the types of cases you're going to be doing as a second year, and really what that third year, what is kind of molding you into this clinician that you're soon to be on your own. So, great point, Nick.
And certainly as we start transitioning into interview season, because that's going to be coming up for our students here in the next couple weeks, do you have any tips or things that you remember going through that you think would be useful for the audience to know about the actual interview itself? Because often these are students, most of them have done externships when they're interviewing, but sometimes they haven't. What was your experience like, Nick?
Yeah, my experience, I really enjoyed it. The advice I got prior to going into interviews was during your externships, of course, it's wise to keep a journal and record how you feel during the externships. But sometimes you forget. But the wise things to do, it's almost like being an athlete. Before you go against your opponent, you want to study them, study the film, study everything you can before you actually go into war against them. So one thing I encourage a lot of students to do is write down, journal how your experience was and how you actually felt every day, the smell, the environment, were you happy, were you sad? And all those things when you're going through interviews will reflect back and allow you to ask questions maybe you felt you got from other programs. And maybe you can ask, the additional programs, hey, do y'all do this, X, Y, and Z here? So I think that the wisest advice I could give you is to record how you feel, what's your end goals in life in general, and where do you see yourself in the profession? Because we all have unique gifts and unique wants and needs. So it is wise to tailor what you want to the program that you want to as well.
Beautifully said. Start with the end in mind. We like that motto very much. Jeff, what
Mhm.
do you think?
No, I completely agree. And you start talking about interviewing for residency. You recently interviewed for fellowships, and you're going to be
I did.
joining a Barry graduate, Kelvin Rushing, in
Correct.
fellowship. Congratulations.
Thank you. Thank you very much. Very
Now,
exciting. Very exciting.
if I remember right, Cal got his training at Westside with Spinner and Madeline Ramil and that group, right?
Correct. Yeah.
He's going to be he's you got a busy year ahead of you.
I'm looking forward to it. It's back in my hometown too, so
Oh,
looking
where is
forward to
that
it.
exactly?
That's Dallas, Texas.
Okay, very good.
Yeah.
Um, Go ahead, Joe. I just kind of thought I got on that little tangent, but I did have one other question before we delve too far into current. Now, I was
Yeah.
reading your CV, and you were crowned Mr. Texas A&M University.
Correct. My first year I was.
I want to hear about that.
Yeah, it was a pageant. As a freshman, you're just trying to figure out, trying to find your place, doing the most random things, joining the most random clubs. But through that, I got the opportunity and nominated to be Mr. Texas A&M University. So it was a pageant. I had to talk and all these things. But wow, that's so long ago. I totally forgot about that.
Well, I mean, I brought it up because that was kind of like a residency interview, probably, right? Put your best foot forward.
Basically, yep.
And in so many different like avenues and like I'm not a pageant girl myself, but the amount of training and rigor that does go into some of that to put yourself on display. I mean, that takes a lot of character, Nick. I'd
It
love to
does.
maybe dive into or peel back the layers a little on that if you're willing to share.
Oh, so long ago. Yeah, so during that time, of course, like a lot of it is you're kind of campaigning for yourself. You're getting to know everyone. I think one of the skills I do have, and probably the people that know me will attest to this, but I love talking to people. I love getting to know their backgrounds and things like that. So I think that was one thing that was very helpful, I guess, for me to win, is that I met so many people and was able to figure out their backgrounds and relate to them. And me coming from Texas, have such a diverse background. Me coming from a Nigerian heritage, but growing up in a Hispanic community, and then going to Texas A&M, which is its own community. I think during that time it was great. Also, the interviews is almost like interviewing for residency. It's all these random questions, random scenarios you get put in. And I guess at the end of the day, they figure out which one is best, whoever answers it the best way, and I guess they saw fit to give it to me. So
I think there are so many similarities and crossovers here. And I mean, you can see the poise that you carry yourself with, Nick. In those situations where you feel like you should do something or should answer one way, how do you kind of bridge that gap between being authentic to who you are versus answering the way you think this other person wants you to? How do you circle that square?
So the good thing about having a lot of mentors is that they want to bring the real part, like the real, for me, the real Nicholas out of me, right?
Yeah.
So sometimes we hide behind the more posh and the more polished answers. Rather, I was actually advised to be more genuine because through genuity, you get to actually express who you really are and who people can actually connect to. So actually, that was more of my approach rather than the whole polished answers. And yeah, I think that's actually what I learned more out of this whole process than anything else.
Oh, I love that. And I will certainly, that was something that I felt very much from you in real life is you're a very genuine person. And I loved that because we do kind of function in a world, especially as a student, where you keep trying to do the thing where you're trying to think a couple steps ahead, like, ooh, but what if I said that and they wanted me to say this? And like you just start to get trapped in your own head. And so what I appreciate so much is that wisdom of looking back and saying, you know what, certainly I'll put the I language back on for myself now. When I was a student, when I finally just embraced, like, look, this is who I am, this is the best that I can do, that's when I did the best job. It wasn't when I was putting on the perfection hat and acting the way that I thought they wanted me to and checking all the boxes. I was a fairly boring turn. And so I was just curious, you're much closer to it than I was. You're still
Right.
far enough away, but still close enough to kind of be running through. And certainly again, with some of that pageant experience, like that's a really unique opportunity at a fairly young age to
Mhm.
kind of wrestle with some of that. And I'd love to maybe transition, if we're ready, Jeff, into you're also, you and your siblings have a social media network that you're a part of. And I think this
Yes.
also really comes out in your family. So Jeff, are we good to make a little quick
Yeah,
transition? We'll come back to the
absolutely.
podiatry stuff, but
That's right.
I just think that this is really fun when you have a whole family full of doctors. And so can you talk a little bit about Doc Sibs and how that started?
So there's six of us. So growing up, there's six of us kids, and I'm the youngest of six. So people may say that I follow in the trends of my siblings and all these things, but understand there's six of us and there's four doctors. So I guess I'll just give their names, but there's Dr. Vera. She is family medicine, where she is practicing in more of a concierge medicine. So she actually focuses on holistic medicine, which is great.
Okay.
The second one is Dr. Hizo or Dr. Sherry. She is sports medicine. So she trained physical medicine and rehab and then did a fellowship in sports. And then my brother, who his name is Dr. Iggy, and he did orthopedics and specialized in spine. So then there comes the foot and ankle podiatry guy, me. So it's been great. It's been good to have that leadership ahead of me. And I kind of not necessarily followed in suit. People think it's like some master plan my parents have. It wasn't. It was just something that just happened that we all ended up going into medicine. So
I have a question for you, Nick. So with the
sure.
holidays coming up, Thanksgiving, Christmas, what's it like around the table? Do you guys check medicine at the door, or does it become parcel to the discussion?
You know, the good thing is now, when I just started residency, oh, I got put at the kids' table every day. But now they
Oh,
finally invited me to the middle school table. So we haven't gotten to the the big leagues yet. But we're in the middle. We're in the middle. We're in the middle. So I'm okay with that. I'm on the minor leagues right now.
it's the part of being
So
the youngest child.
correct. Yeah.
Yeah,
It's
bringing up the
great.
tail.
Well, also, Joe, when you're the youngest, you're not quite as politically correct. You just tell it like it is, which I think is a good trait too, at least with a lot of the younger.
Yes.
But that kind of is in
Jenna.
conflict with the political. So I say political because you were involved at APMSA, you were on the executive board as a student,
Was.
you were at the
Was.
Florida Podiatric Medical Students Association. I mean, you've been involved to the hilt. I
I
imagine being
tried.
the youngest of six. I mean, I imagine that gave you lots of ability to negotiate and maneuver.
hmm I learned over the years. I got trained very well. I got I got trained very well.
The beautiful thing about being the youngest is you can watch your siblings make mistakes. And if you can learn from them, then you don't have to make the same ones as obviously. You still make your own, but you can do it in like, oh, I'm going to see what they did. I'm going to test it just a little bit different this time.
I always wanted to be the oldest, and then now I look back, I'm like, I am A-okay with my position. Absolutely.
So I didn't mean to derail the conversation, Joe. So Nick, how did the social media aspect come about? Like, who was the guiding force, or what was the motivation?
I think I have to pay homage to my eldest sister because she's the one that started. I guess she was the first doctor in family medicine. So she's the one that started, I guess, the train of us that there is now. But I guess I will give it to my brother, and maybe he'll watch this later. But I'll give it to him. He's the one that took the next step to bring it to social media. So when he started to expand and get bigger, it kind of drew all of us in as well. And through that, we realized that we have a very unique story and a very unique perspective on a lot of things, whether it's medicine or life or health or business. So we decided to say, you know what? Actually, one of my other sisters, her name is Linda. She is actually a brand strategist. And through her company, she's like, hey, I see a vision here. Let's actually bring this to life. And that's actually how Doc Sibs came about.
Did you know APMA provides help with public health initiatives such as fall prevention, opioid abuse prevention, and addressing health disparities?
Did you know The APMA provides over $400,000 in scholarships annually to students pursuing podiatric medicine, helping the next generation of foot and ankle specialists.
If you're serious about this profession, if you want to grow, to lead, to make a lasting impact, join APMA today.
I love that. It's like using everyone's talents and supporting each other. And you're absolutely right. People love hearing perspectives, and especially then fun stories where there's, 4 or 5 of you that are kind of coming together and building this network and support. I think it's brilliant. And I've enjoyed very much following. I didn't know there were 6 siblings. I'm pretty sure I follow at least 4 of you, but I don't know if I follow everyone. So now I'm going to have to go and do some more searching. But
go for it. Go for it. The 6th one doesn't really have social media, but she's definitely even more of the pioneer from the first doctor, because she's a nurse, so she's actually the one that started everything originally.
So she's really the secret sauce. Yeah.
Well,
she's the one.
Then there's my dad. There's too much. It's everyone.
Well, I'm sure your sister, the nurse, is at the adult table at the holiday.
That's the adult. That's what the parents, the masterminds.
So Nick, I have a question for you about social media.
Sure.
Joe and I, while we were, preparing for this interview, we were talking about social media with our podcast, and we're on YouTube and we're on Instagram and we're on TikTok, and we've got Spotify and Apple Podcasts, and it seems like there's all these different platforms. What have you found as a family? Like, where have you found your home? Where's your niche, if you will?
Instagram is our niche. I'll be honest with you. Instagram, it provides the visual and the audio, and they put it together and allows you to do photos, allows you to do videos. And through that, we have been able to just connect with so many people in the field, whether it's in ortho, sports, podiatry. It has really been very beneficial to us.
Do you have like a stage name or anything, or?
Who, me?
Yeah.
I mean, I'm Dr. Iggy, I guess.
There you go.
That's my stage. Dr. Iggy DPM is like my stage name.
I think that's just so fabulous. Congratulations to all.
Thank you so much.
And I'd love to kind of bounce back to the leadership positions that you've held, because Nick, you've been heavily involved in research and multiple different leadership opportunities. Yeah. You've also had opportunities to engage in community health. I see you've done research in this idea of social determinants of health. But the one that I'd love to kind of pick your brain a little bit on is you had the chance to go to the Dominican Republic. And this looks like it was like right before the world shut down with COVID. And I'd love to get your experiences with public health, and specifically with this medical mission work. How did that impact you in the early phases of your career?
Yeah, so in college, I always wanted to travel abroad or study abroad, and never got the opportunity. So in my first year of podiatry school, when we were presented with the opportunity to do a mission trip abroad, I was like, this is a no-brainer. This is something I've been wanting to do for like my whole life. And you're right. It happened right around the time that COVID happened. Actually, I think the world started shutting down slowly right as we were coming back. So about a week after we came back, all the classes shut down. So we were actually very lucky to be able to come back just in time. But yeah, that experience was so humbling. If I could do it again, if I can go back in time again, I would do 10 times over. And the people there are super appreciative. They don't require very much. And we feel like we didn't do enough, but they felt like we gave them the world. And even in residency, I've been privileged to even travel with my program to Mexico as well, San Miguel, where we also got to do a mission trip as well, where we provided orthotics, did surgery, and just followed up with patients from the previous year. So it has been something I have carried with me, and every patient I encounter, I see them as family. And I try to speak Spanish as much as I can. I'm still learning. The lingo is kind of failing me a little bit, but it's okay. But just seeing them happy that you're even trying to make a connection has been something I reflect on with every patient I encounter.
I love that. I was going to ask you about the medical Spanish because you had said you had grown up in a Hispanic kind of community, and I didn't know how fluent that, because in there we talked about utilizing medical Spanish, and so my medical Spanish is mucho poquito. So I was curious if you had more opportunity to refine that, or kind of what that looked like for you.
That's right now, that's a sore spot. Unfortunately, I did go to Miami for school, so the whole hope of going there was to learn Spanish even more. But then COVID happened, so that really decreased a lot of interaction that I could have had with a lot of people, whether locals or patients. And I try not to think about it too much, but we're trying to get back on it because Houston has a big population as well. So I'm really passionate about that.
Yeah. Well, that you and I can become Duolingo buddies now, and we will try to learn, because I try to learn Spanish and then French comes out, and that is not useful to me at all. But that is just like my brain has two settings. It's like English and other. And when I try other, even we tried Italian and Spanish, and it reverts to French, because that's like, I don't know, two settings.
Oh, I didn't know you speak French?
Also very little.
Oui, oui.
But that was the first foreign language I ever learned. And at one point I actually got quite good, but then I never had the opportunity to really use it. So I should have taken Spanish, but c'est la vie.
Okay.
How about you, Jeff? Do you speak any foreign language?
I took French in 7th and 8th grade.
Okay. Yeah.
Okay.
And what I learned was that while I was taking French, my wife and I didn't go to high school together, but she took Spanish in high school. And when we were in college, we went on a trip to Mexico, and I kept saying, Celia, talk to them in Spanish. She said, I took Spanish, but I can't speak it.
Yeah. Yeah, my husband's really good. He picks up languages really quick. And my best friend speaks like 12 languages, and she's fluent in like at least a handful of them. And I'm just like, that's just amazing to me. That is not a talent that I possess.
No, I'm envious whenever we travel and we meet people that are speaking multiple languages throughout Europe.
Yeah.
Nick, can I shift gears just a bit, Joe?
Sure, absolutely.
Yeah. So Nick, Joe and I have been given lots of advice to students about clerkships, and then we have students that are getting ready for interviews for residencies, and we're always trying to prepare students for that next step. Well, now over the last few years, we are getting more and more of our graduates that are in residency coming back to us and asking us about the fellowship situation, and should I do a fellowship? Shouldn't I do a fellowship? When should I start applying? When should I start looking at it? All of those questions are just front and center right now, Nick.
Right.
What was your experience with that?
Yeah, so it was similar to, I always revert back to college because that was like the foundation of everything. But it's almost like college when you're planning on going to med school, if you're thinking about medicine, it's something that you think about on day one. And even if you don't think about it on day one, you think about it relatively soon when you start hearing like murmurs about it, you start trying to figure everything out. So the same thing when I was in school, I heard about it a little bit. But towards the end of my 4th year in podiatry school, something that I held on to, and I actually got to meet Dr. Rushing and Dr. Alton Johnson, Dr. Liu, Dr. Van, all these big people. And I was like, man, how do I get there? How do I get there? And a lot of them did fellowships. And I wanted to know, okay, what's the difference between going into a job or doing a fellowship? And truth be told, something about the field and podiatry is that if you want to be the best, you always want to aim for the gold. At least that's what my dad always tells me. He says, aim for the gold because at least you aim for the highest. So fellowship for me was more of an opportunity to further our profession and also an opportunity to show, hey, we got talent on this side as well. So that was my approach. So when I would encourage students or encourage residents to start looking your first year and start reaching out as a first year or second year, because you apply your second year technically going into your third year. So it's something you have to think about relatively quickly if you are planning on doing it. But there's fellowships, they're growing, they're more and more. And a lot of times, how do you figure out which one is better, which one is worse, and all those things is really the word of mouth, going to APMA, going to Act Fast, all these different conferences, APS, or it was ASPS, like all these different conferences is really where I got to hear and learn about fellowships and people that came out from it, and seeing the product that was coming out, I said, I need to be a part of that. So.
So what attracted you to Dr. Calvin Rushing's program?
So I mean, Dr. Calvin Rushing is a rock star. We all know that. He is someone that takes his profession he keeps it very close to his heart. He probably sleeps with it. He wakes up, he does everything with podiatry. And that's something that, a lot of people in our profession does. Even y'all are doing it with a podcast. These are things that, people are furthering our scope. People are furthering our visibility of podiatry. When I was coming out of college, I did not know what podiatry was, but there's so many people now reaching out on social media or LinkedIn or anything like that that is not asking, hey, I heard about podiatry through you or through this doctor. I want to know about it. Seems like y'all are really good at what y'all do. So when I found out about Dr. Rushing, it was something that he was pushing out papers, and I also was able to articulate himself in a way that I don't think I've seen many professions be able to do. And once I saw that, I was like, that's someone I want to learn under, of course, and be the best I can be.
I think that's just a great story.
Yeah.
And I don't blame you. I mean, Calvin, as a student, he was incredible, and I've been following his career throughout. So that's so neat that he's running the fellowship now, and you have an opportunity to go there. It just kind of illustrates, Joe, how small the world is in podiatry.
It is. And pre-show we were talking, it is a really small world. I get to work with his scrub tech now because he moved to Arizona. So this is my shout out for Junior Mint, his nickname. That way we can keep all the appropriate confidentialities. But you'll have to ask Dr. Rushing about Junior Mint. So
Absolutely, I will.
I'd love to piggyback on that because you're absolutely right. There's so much that people just don't know about podiatry. How did you find out about podiatry, Nick?
Ooh, so going back to the whole siblings and Doc Sibs and all that stuff.
Yeah.
So one of the siblings, the one that's in sports or did a fellowship in sports, we were at the time I was trying to figure out I wanted to do nursing because originally I wanted to do nursing and then physical therapy. And I was like, I've been running away from medicine. Like, I don't know if I want to go back, but whether faith or whatever the case may be, I got pulled back and I was like, you know what? Whatever I need to do, I just need to be successful. I just need to put food on the table and I want to enjoy what I do. So that sibling actually was reading a paper because she was doing research and she was like, hey, Nick, like I'm reading this research. It's about sports and there's this DPM that's a part of it. I know they work in the hospitals, they're doctors, they're physicians, but I don't know how you actually get there. So I just thought that that would be like something else that you can look up. So I was like, okay, I'll give it a try. And I mean, I kid you not, I looked it up. There was a doctor in Houston who went to Texas A&M, which shout out to the Aggie Network, Dr. Applegate. I reached out to him and he didn't pick up. And I was like, what? Oh no. So I called him 2, 3 times. He didn't pick up. And yeah, I said, you know what? I'm just going to leave him a message. And I'm like, hey, I'm an eager student. Just really want to learn. I'm from Texas A&M. And he ends up calling back and was like, I just didn't know if you were a telemarketer or not. But I would love to tell you about the film. And he opened the door and connected me with so many different physicians throughout the whole Metroplex, throughout the whole metropolitan, from College Station to Houston to Dallas. And I mean, there's so many names, Dr. Correa, Dr. Lowe, all these doctors that now I get to practice, do residency under. It's a full circle moment for me. So that's actually how I found out about the field. And I went into my first surgery shadowing. I think I saw a toe amp and the blood that came out. I was just like, this is it. This is it.
So Dr. Correa, you're talking about Damian Correa, right?
No, Chris Correa.
Oh, okay. All right. I'm sorry.
Yes.
Very good. Well, I was going to give a little shout out there. That's fabulous. Well, little sidebar story. I did a virtual event for Montana State this week to their pre-health course. And afterwards, I got a really nice note from the advisor who said, thank you, of course. We appreciate your time. She said, so many of our students never heard of podiatry before, and now they're considering it as a viable option for them going forward. So much of it is, on the radar screen. Like, we need to brand podiatry.
Yes, we do. Absolutely. I'm encouraging all my social media people to, keep on pushing the message. So,
Are you on LinkedIn?
I
Yes,
am. I
that's
am on
That's
LinkedIn.
where you found each other?
That's how we
yeah,
followed each other.
All right.
Well, I'm mainly
that's my
on
primary social
Instagram.
media.
Okay.
Yeah,
Yeah, Instagram is my primary, but yes, LinkedIn is
yeah.
also an avenue for me too.
Oh, that's
I don't
fabulous.
think I'd ever get off of Instagram. That's my problem. So
That is a real thing.
I'm too much of a visual person, and you just get sucked into it all. So
So
Exactly.
you know it'd be fun, Nick, when you get out into your fellowship and
Yeah.
you're working with Dr. Rushing, get you both on together.
Hey,
that would
well,
be
I
really
look forward to
fun.
that. That would be
Yeah.
awesome. I think he'll
Yeah.
be open
Yeah.
to it too.
I've got a circle around with Calvin. I mean, I've been like I said, I've been following his career and would love to get you both on. It'd be fun together.
Thank you. I mean, I look forward to it. I'm sure he will look forward to it too.
Joe, you want to do a little rapid fire?
Oh, I think we definitely do. This is the fun kind of rapid fire, Nick. It's not like the put you on the spot in a bad way rapid fire.
Okay.
Do I get to start?
You may.
All right. So I saw this is also a little bit in your personal interest portion of your CV, composing music.
I saw
What
that.
kind of music do you play and or what kind of composing do you like to do?
So it's I will say it's something that most athletes really, really like, but it's rap. So I just like
That's
rhyming
awesome.
words and putting words together. It's a fun thing for me.
Fantastic. Um, anything that we might be able to discover? Like, have you put an album out? Have you put music out
Oh,
anywhere?
I got one song, probably a couple more going or coming out, maybe. Until residency, kind of fizzles out, then maybe we can start that back up. But I have
All
one
right.
song out.
All right. Now we're all gonna search you now on wherever people search for their music.
Go
But
look it
all
up.
right, that was mine.
Oh, that's fabulous. So when you're in the OR, do you get to pick the music ever, or do the attendings all pick it for you?
It depends on the attending, but now that I'm a third year, I have got into the big kids table where they allow me to play music now. So I get my little speaker, my little JBL, and connect it and start blasting my music. But I try to accommodate for everyone. So my playlist is very, very mixed with all types of culture, all types of music sounds. So whether it's country, whether it's rap, whether it's Afro beats or Latin music. I
Mhm.
listen to or pop, any of it. I even have some
Yeah.
Indian music on there too, so I have everything.
Oh, that's fantastic.
Yeah.
So if you could go anywhere next in after you get out of residency to do a medical mission, where would you want to go?
Ooh, don't ask me that. Ooh, somewhere in Africa, honestly. I heard
Yeah.
Tanzania is a beautiful place.
Yeah, I've been to Tanzania. Yeah.
South Africa, I mean, I'll go anywhere and everywhere, to be honest, at this rate.
Did you know, Nick, that uh, at Barry we were doing mission trips to Togo back
Really? No.
2014, 15, 16. Yep. It was incredible too.
Why
I'll,
didn't
I'll
y'all call
connect you.
me?
Yeah. All right.
I'll take it. I'll
All
take
right.
it.
Anyways, I'm with you. Africa's awesome. Go ahead, Joe.
Yes.
All right. So you had mentioned that you love meeting different people, talking about backgrounds. If you could invite anyone to dinner from any time in history, could be famous or non, who would you invite and why?
This is no longer rapid fire. This is now I gotta think.
These are deep intellectual questions.
Who could I invite at any? Oh man. Oh, I'm. I love basketball, so I'm going to have to go with basketball legends. But for me, it would have to be either LeBron James or Steve Nash. And the only reason I'm picking those
Oh,
ones
yeah.
or Michael Jordan, either three. But the only reason why I'm
Yeah.
picking LeBron James or Steve Nash is because I just like the fact that they also connect to so many different generations of people and
Yeah.
cultures outside of themselves. And I think that would be awesome to have a dinner with and just sit down and pick their brain because their profession, they tie their profession to their actual lifestyle. And I love that the way they take care of their bodies, the way they appreciate the art of sports in general, whether it's soccer or basketball or football, everything has an art to it. So even even in surgery, we have an art to it. So that's something I want to pick their brain.
Oh, I love that.
Oh, me too. We could go down the basketball rabbit hole in a hurry. But so I'll make it easier though. So
Okay.
you're gonna go out for Steve Nash, LeBron, Michael. You're going out for dinner. What kind of dinner are you taking them out for?
Okay. Joe, you're really hurting me here, okay? What type of dinner am I taking them to?
Yeah, what kind? I mean, Mexican food. Are you going for Italian? You gonna go Greek? You gonna
Mm,
go sushi?
I don't do sushi, so that's next.
So
Oh,
that's easy. That one's
Italian.
off the table.
Oh, Mexican. Oh, I may honestly just bring them to my homeland. I may have to just do Nigerian food.
Oh
Oh,
yeah,
I
there you
love
Oh
go.
it.
yeah.
So then I'm
What,
going to ask,
I'm not.
what's your favorite dish? Oh,
Yeah, I'm
sorry,
not
Jeff.
familiar. No, I'm not familiar with Nigerian food. What kind
Ooh,
of?
so I can put y'all on just a little bit, but I'll
Yeah.
say our staple food is jollof rice. Jollof rice is like it's almost similar to jambalaya, but ah, if I see y'all in person, I'm gonna make y'all a big old plate of it and give it to y'all so y'all can have it. But jollof rice is one of our staple food in Nigeria, and I just absolutely love it.
Oh, that's fabulous.
Yeah.
It's very fragrant.
Yes.
When you had also talked about cooking, is it Nigerian cooking that you prefer to do?
Yes.
Oh,
Yes.
that's
That
awesome.
is
What's
one
your
of them.
favorite thing to make? Is it the
Jollof
rice?
rice is definitely one of those favorites.
Okay.
There's a goosey soup. There's so many different ones, but I would say if you gave me one thing to eat for the rest of my life, it would be jollof rice and chicken.
All
Absolutely.
right.
Really
All right.
fantastic.
Yeah.
All right,
Yeah.
very
Are
good.
there good Nigerian places in Dallas where you're going to be heading next?
I mean, yeah, it's called Mama's Kitchen.
Oh, well, you can't
Oh,
beat Mama's Kitchen.
Ah, exactly. But no, yeah, I grew up there, so I know all the hot spots to go to. So I'm excited there. I love Houston as well because this also has it's very ethnocentric to all the ethnic groups. So my people food is here as well. Mexican food is here. Asian food is here. Indian food, everything is here. So I really like this place as well. So
That's wonderful.
I'm gonna
I used
miss
to
it
go
a
to
little bit.
the Woodlands every month, once
Ooh.
a month to the Woodlands to train
Oh,
wound care, believe it or not.
oh,
That is so fun. I was going to just throw a little sidebar in there. I oftentimes wondered if I could get like a ex-basketball player, like Hall of Famer who's not in demand to come on
mhm.
the podcast, Joe, kind of like we had Derek, the Olympian.
Oh, man.
And
We could have so much sports psychology. It would be
yeah.
amazing.
So,
Yeah.
so my pick, Nick, would be Oscar Robertson from back in the day. He played
Ooh,
for the
that's a
Bucks.
good one.
Yeah, he'd be triple double, Mr. Triple
Triple
Double.
double. I mean, we may have to get some of our basketball gurus in the podiatry field, whether it's Dr. Dahir or Dr. Lucido, I don't know, one of those, or Dr. Sexana, anyone. So we'll
Well, when
see.
I was in Miami, we'd go to games with Jim Lucido. We'd have a blast.
I love that guy. That
He's
that
the best.
is I love
All
that
right.
man.
Well, Nick, you are just such a star. Thank you for taking time out of your busy schedule as a resident to join Joe and I on Dean's Chat. Sure appreciate it. Any last words, Joe?
No, thank you so much, Nick. And thank you for just being you, being the amazing human being that you are, and being willing to connect, and then also be bold to walk up and just say, "Hey, it's nice to see you in person." I love that. And I don't know if I would have had the bravery to do it when I was a student. And not that you're a student, you're a resident, but you're still young in your career. And I
I did
just
it
think
as a
it's
student, don't worry.
remarkable. Oh, that's good. Yeah. So I think that everything that you're doing is wonderful, and I appreciate you sharing your time with us today. So thank you so much.
Thank y'all for the invite. I really appreciate it.
You're so welcome. And to all of our listeners out there on Spotify or Apple, if you get a chance, give us a 5-star rating, or even better yet, leave a comment. If you're watching on YouTube, we'd love for you to become a subscriber. Joe and I will continue to bring leaders in our profession and future leaders in our profession. Thank you, Nick, for joining us again. And we're going to send you one of our Dean's Chat mugs. Cheers. Yep. All right.
Cheers.
Cheers, everybody. See you next week. Bye-bye.
Bye bye.